the acting MEC for Health, MEC Jacob Mamabulo, and the MEC for Education, Panyaza Lisufi, and the MEC for Social Development, Dr. Mukheti. So the Premier will start the briefing, as I said, he will lead, and then the other MECs will speak on specific matters, and then we will take questions. Over to you, Mr. Premier.
Good morning, ladies and gentlemen from the media and the people who are watching this weekly briefing from home. This is our weekly media update. Today, the 7th of August. We will do it the way we have done it before. Just to give an update on our health response and what the picture looks like. Continue to indicate how we are doing with regard to our social relief and food security response, and the work related to education. We will get an update on that. And we'll also give you an update on the work pertaining to investigations into PPE procurement corruption allegations. We always start with what the national picture is like. This is what has been presented by the National Minister of Health, Dr. Zweli Mkhize. Where our country is, everybody is aware of that, what the confirmed cases are and the recoveries, and the number of people who have succumbed to COVID-19, the number of tests, and the new cases as of yesterday. The picture, this is not moving. Okay, thank you. Thank you. So you know that when we do a weekly briefing, week by week, there are shifts with regard to the number of active cases. We do a comparison by a week. There are also shifts with regard to the recoveries. There are also shifts with regard to the number of people who have succumbed to COVID-19. Again, this is a national picture. Gauteng province constitutes now 35% of all the confirmed cases, and that is why we are the epicenter. We got to this situation in June when we said COVID-19. The COVID-19 storm has arrived in our province. We went through a very difficult period, June, July. You'll see as we get to indicate what has been happening, at least in the last 2 weeks in the province, that there is the surge is going down. But we are not out of the woods yet. It is important that this message comes across, that we are not out of the woods yet. One of the important things that we always show you is when we went through a period, particularly in June and July, when we had high number of daily infections. And when you have that and much fewer recovery rate, we are back to a situation where there are more people who are recovering and fewer daily infections. The National Minister of Health spoke about this, about the 3 provinces where there is a slowdown with regard to the surge. And I want to continue to say that observing that is comforting, but we cannot send out a message that we are out of the woods. We don't want any complacency, and in fact, we should be stepping up quite more. And that's why today's briefing, as we deal with all the other issues, we want to continue to give ourselves, the Department of Health, civil society, communities, an opportunity to really rally as we go to the peak that is set to be going to be now in August, September. As we approach that, we don't want any sense of complacency. We want an opportunity. Many health workers, community health workers on the ground, who are now doing tremendous work, moving from area to area, which are areas of infections. We want those workers and our health professionals who are in our health facilities, who are working very hard, treating the sick, the infected, saving more lives. We want this message that we are focusing our energies, directing our energies on the principal job, and that principal job is ensuring that we overcome the worst of COVID-19. We reduce the number of infections. We also save more lives. We can only do so if we are focused. At the same time as we're focusing on this, we must also deal with malfeasance that has really brought government into disrepute. And I will do an update about dealing with malfeasance. So when this graph, when we have fewer active cases, as you would see, and then we have more recoveries, that's a good story. Because we always said the graph of active cases needs to be flattening, and the graph of recoveries needs to be the one that is essentially going up. There was a period in June, July when our recoveries were up to 30%, had dropped from the 60% that we have had during April, May, and the recoveries had dropped to 30%. Where are we now? It is comforting to see that as of this week, the recoveries in Gauteng province are now 70%, and the number of active cases are 29% of all the cases. The case fatality rate in our province continues to be at the level it was for a long time, just above 1%. And that's something that we are observing week by week. There are some weeks when we get more people who succumb to COVID-19. And we have gone through a very difficult period, particularly in the last 2 months. We've gone through a period where we have lost a lot of people on a daily basis succumbing to COVID-19. We also went through a difficult period where our hospitals, the hospital admissions were really bursting at the seams, and the situation is better now. We will get an update from Dr. Mdisani around this, about the situation with regard to hospital admissions. We will get that update in the course of the briefing today. Last week, we had an opportunity to get the modeling team to talk about the hotspots, and they were able to indicate that even in our hotspots are running their course. the number of active cases in the hotspots is also going down. Of course, there are new hotspots, and I'm going to show it here. There are areas where we have new hotspots where the number of cases is going up. But when we have more hotspots running their course, the virus burning out, the number of people infected reaching the peak in a hotspot, and now we begin to have fewer and fewer infections, it's good. It's also a response to the work being done by teams on the ground, community health workers, activists in communities who are being sent with the health professional teams to those areas that are hotspots. So there is a positive story with regard to the recovery rate in Gauteng province. It is back at 70%. There's also a positive story with regard to the number of active cases. They are going down. There was a period in June, July, when the number of active cases were back at 65%. Now the number of active cases are at 29%. And again, if you just look at a comparison, we always show you this graph that shows that during level 5, the number of cases we had, level 5 and level 4, the number of cases on average we had, the maximum number of cases would be 60 cases per day, and that was level 5, level 4. And then when we got to level 3, we started having an increase to above 100, to 200 a day, 300. And when we got to particularly June and the beginning of July, we got to the highest number of cases a day, above 6,000 cases a day. That's still a period that was difficult. And from there, the number of cases have been varying. First average 5,000 a day, and then you will see that a number of cases now are averaging at least 2,000 a day. And there is an issue that will be explained about the relation, whether this has a relationship with the tests being done. Overall, our province, the daily infections are going down, and I will show in the next set of slides that also the hospital admissions are going down. Even elsewhere in the world and everywhere in the world, when you have the daily infections going up, you must be very, very concerned. The surge is happening. When you have increases in hospital admissions everywhere in the world, you must be very concerned, because increases in hospital admissions will lead to increases in ICU admissions and then lead to more people dying in that situation. That's as a consequence of that. So we share with you what the picture is per week. You would see. So this is week by week. The worst week we had with regard to the daily infection or weekly infection rate was when we had the average of 5,196 cases in a week. Now you would see that our average has dropped down to 1,765. The Minister of Health showed a different graph, but all these graphs are showing that there is indeed the surge is easing. We don't want to say as yet that we have passed the peak. It may have been a wave. It may have been the first wave of the peak. We are still working on the basis that we may still go through the toughest time of the storm. And we are still working on the basis that the worst is still to come. And this is the right message to send, because once we send a different message to say to people, oh, the situation is now okay, people who have been responding to the message of wearing masks, those who have been responding to the message that don't go out there in the public, do social distancing, no parties, no marches all over the place. This is a very important message we have been saying. These have been the funerals, again, the drivers of the daily increases in infections. So even as we see that there is some decline in the number of infections, we want to say that we still have to work very, very hard. And I know I get a briefing every day about the work being done in the sub-districts by our health workers who are targeting the areas which are the hotspots, including the work they have been doing in the last few days in some of the hotspots I'm going to show here. So what Dr. Mkhize was saying, that in the Western Cape, in the Eastern Cape, and in Gauteng, the number of cases per day are declining. That evidence we're also showing that evidence in terms of what happens per week, the average number of cases per week. We are showing that there's ample evidence to demonstrate that. But we are saying this does not mean the worst is over. We must still prepare for what the modeling is saying will still happen during towards the end of August and in September in this regard. So the regional breakdown, we always give this regional breakdown. Johannesburg, so if Gauteng is the epicenter, Johannesburg is the epicenter in Gauteng. The number of confirmed cases in Johannesburg as of now is 76,297. The number of recoveries in Johannesburg is 59,779. And the number of active cases in Johannesburg is 15,548. And close to 1,000 people have succumbed to COVID-19. To be precise, 970. Followed by Ekurhuleni with 41,000 active cases, confirmed cases. And then Tshwane, the three in our province. So Johannesburg, Ekurhuleni, and Tshwane are high-density metros. In that regard, they always would naturally have more people in those areas. And then the two districts in our province, Sedibeng and the West Rand, in terms of the number of confirmed cases, the districts are more or less at the same level. There was a period where the West Rand was quite low and Sedibeng was quite low. At the moment, there are 12,000 each of them. They've evened out. And we know that in the West Rand, it was the mining areas that drove the infection. We will show you what's happening in that area there. Whereas in Sedibeng, it was the key townships that drove these increases in infections. The sub-district numbers. So if you ask the question, where do we have the largest confirmed cases in Gauteng province at the moment? It is a sub-district in Johannesburg or a region in Johannesburg. That's Region D. Now, Region D is Soweto. It's the Soweto area. That's where I want to remind you that there was a period in June where the largest number of active cases and confirmed cases were in Mayfair, in the Mayfair inner city area. And then there was a period in May where in Johannesburg the largest number of active cases were in the Ivory Park Midrand area. In each of those cases, we went into those areas to do some work in those areas. And I'm very glad that there has been very systematic work by our community health workers, health professionals, and community activists in the Mayfair area in this week, and last week and this week, and they also went into the Orange Farm area. So when these numbers are where they are, I was told that they are now focusing on Soweto. When we say Soweto, it's at the moment, the sub-district that has got the largest number of confirmed cases is Soweto. That's where we are going to direct lots of interventions in those areas, including law enforcement of funerals, ensure there are no parties, there are no public gatherings, but also mobilize communities in those areas to come to the party on the social measures, to also ensure the communities know their own areas, which sections of Soweto has got new cases. They need to know so that they can protect themselves. And then we are able to point out the sub-districts that have got the largest number of new cases in that way and follow them. So the highest confirmed and active cases in the sub-districts per week. So in this week, again, I've just spoken about the slide that shows Soweto has got the largest number. So again, this is the slide that shows you that Soweto, which includes the different areas of Soweto combined, Dobsonville, Doornkop, Protidland, those areas, that's where we have the largest number of confirmed cases in the province, followed by another area in Johannesburg, that is the inner city of Johannesburg and Mayfair. This is the area that used to be, there was a period, as I say, that it was really the largest, the area with the largest confirmed cases. It's still there, but there's interventions that are being done in that area. And then it's followed by the Alexandra, Wynberg, Sandton area, followed by an area in Tshwane, that is the Atteridgeville, Lodium, CBD area of Tshwane. So in Tshwane, at the moment, the area that has got the largest number of cases is the CBD, Pretoria North, Atteridgeville, Lodium area. And then followed again by Johannesburg, and you'd see the number of sub-districts that have got the highest number of cases. In every region, we do have one or two. And if you ask the interventions that we are making, the grassroots work, the focus and energies of our health workers, those who are not in the institutions, those who are not treating the sick in the hospitals, those who are on the ground in the district facilities, in the clinics, their work is directed by this data that says, in your area, we've got a problem, a big problem in this. Don't only sit in the institution, but go out there to help us attack the areas that are a big source of infections in Gauteng province. Again, we present the same information in a different way. I want to quickly, so this is the 7-day increase per district. This is information that is important for our communities. It's information that's important for those who are working on the ground. We're making this information available between last week and this week, where did the daily increases happen. The largest number of increases happened in different areas. We also share with you the gender breakdown of those who have succumbed to COVID-19. This is the information we share all the time. We indicate that 55% of those who have succumbed to COVID are males and 45% are female. And 65% are people above the age of 50, basically between 50 and 79. This is still the story that those who are at greatest risk are people above 50. And this is confirmed by the figures that are coming out. But we're also seeing that there are, in other categories, 11% of those who have succumbed are in the age 40 to 49, and the younger people who are in the age 33 to 39 is 5.4%. This information is important for epidemiologists and scientists to tell the story of who is most vulnerable, and that trend is continuing. But I must also indicate that from infection point of view, we have seen significant number of young people who have tested positive, and women, especially during June, July. A lot of younger people in the age 20 to 29 who have tested positive, and a lot of women who have tested positive in that period, especially between June and July. And answering the question, why would it be women, is something that our data scientists are still following up on. More analysis about fatalities. I will leave this one. The story of those with comorbidities is still an important story, that it is people who have other underlying diseases that are most vulnerable. Again, this is the story of COVID all over the world. It's confirmed here that the largest number of people would be 58% are people who either have diabetes or hypertension, and the rest, it's other categories. Testing. The Gauteng province still has the largest number of tests. We have reached 1 million now. 34% of the number of tests conducted nationally are done in Gauteng. There was a period when it was 33%. There was also a period last week it was at 35%. So it's slightly lower, but it's still above the average of 33% that has always been what we have done over time. I want to leave the scenarios they were presented. I just want to go and deal with the hospital admissions, and I said Dr. Mdisani will say something a little bit more about hospital admissions. You would know that there was a period when our hospital admissions were about 5,000, and in fact, there was also there was a period where we had 7,000 hospital admissions in that period of June, July, so the hospital admissions are now at 4,688, almost close to equal in the public sector and in the private sector. We had a little bit more in the private sector, in the public sector now. We used to have more in the private sector. We have more in the public sector now. Those who are on ventilation is 316, and then others are on oxygen. You would see that the different categories of, and others are just, even if they are not in ICU, they are in general wards, and then the availability of oxygen is very important. And that's why all our facilities have, the general drive is to ensure that even in the field hospitals, the critical issue is to ensure that there will be oxygen available so that people who would have difficulty with breathing will get assistance in that regard. So I will ask Dr. Mdisani to come and talk about the hospital admissions again. Just to give a picture, there was a question last week about what has happened with regard to when the suspension of the sale of alcohol happened and what's the situation now. Dr. Mdisani will talk about that briefly. The number of public servants who have tested positive in our province, out of that 172,000, we have 5,242 who have tested positive. In the number of those who have recovered, we have a lot of our public servants who have recovered. But as we speak now, 5,242 public servants are COVID positive in Gauteng province. And in that category, we have had a lot of healthcare workers. The good news is that a lot of healthcare workers have recovered. There was a period in June when we had a real difficulty with too many. I know it even when in a few weeks ago when I was COVID positive, I know it. The health workers said there are many health workers. Some of them were said their facilities, their clinics were running at 50%. And I got a feedback again from them that a lot of those healthcare workers are back now, have recovered. So there was a period where the impact of COVID-19 on the healthcare workers, the frontline people who are the ones really in the forefront of this battle were severely impacted. We have lost a lot of healthcare workers as well. But the good news is that a lot of them have recovered now, are back. And those we have lost, we have conveyed our condolences to their families. These are frontline soldiers, doctors, nurses, and various professionals who have succumbed to COVID. We say, may their souls rest in peace. The PPE stock, we continue to, even as we deal with corruption that has been related to PPE and the investigations underway now, we don't want to run out of PPE. The critical thing would be to ensure that any new PPE supplied is done in accordance with the regulations. So in other words, what has happened, which I'm going to come back to what the consequences of that is, we don't want to happen. We do want to make sure that there is enough PPE as we're preparing for the peak, and it must be PPE of the right quality. That's something that we do want. We don't want a situation where the rogue and corrupt elements focuses us away from ensuring that there is enough stock for PPE, because our troops, the healthcare workers, are on the ground. They are fighting the battle. They need appropriate equipment. They have not stopped fighting the battle. They are there on the ground. They need PPE every day as they fight the battle. So as we deal with corruption, we must ensure they have PPE that has been procured properly and of the right quality. That's something that we want to continue to address. There will be the issue around food security, which will be addressed by the MEC for Social Development. I want to leave this one out. The schools, I want to leave the schools out for MEC Lesofie, who will have a bit of more to say about the schools. And I just want to, on my side, I want to conclude by doing an update on corruption investigations. I said last week, speaking here, that the damning allegations of corruption regarding the procurement of PPE in Gauteng province have profoundly eroded public confidence in the collective work of our provincial government, and in the work we have done so well in a sustained period in the fight against COVID-19. I didn't mince any word about this, that this has undermined, severely eroded the standing of our provincial government. I also made a commitment that we will get regular updates because I reported to you that we asked the SIU to look at this investigation at the end of May. We started this process at the end of May, and I said last week that I will continue every week to give you updates. Whenever we get some update from the SIU on their investigation, we will also be doing public updates around anything of significance. As you are aware, we said also that if in the course of the investigations, as they do their work, the Special Investigation Unit, if they identify an area of risk with a great deal of evidence where we must take action, I said last week we are going to take such action, including where they've been able to establish that certain things have gone wrong, including that cases will be opened immediately, so that we don't wait for the entire investigation to be completed and only to act after several months or weeks, depending on how long it takes. And in that case as well, that the SIU, in our discussion with the SIU, they also indicated that their mandate would be clear, that where they already established criminal activity having taken place, matters will also be, as they continue investigating, they said matters will also be referred to the relevant authorities, law enforcement authorities in our system of government. The SIU may also recommend, which is something I said, where they've identified, as they do an investigation, they identify that things have happened that are wrong. They'll also recommend to us immediate action to be taken against those implicated. We know that the SIU is empowered to take steps also to deal with the issue of asset forfeiture and asset seizures, working with the other institutions, and immediate cancellation of contracts. They are empowered to do that. So as they do this work and they identify in this area there's already a case, we're not going to wait until the entire investigation is done. We will be acting as they undertake their work. So what is the update? Yesterday, we received an update from the Special Investigation Unit on their work regarding PPE procurement investigations in Gauteng. And I want to say that the SIU is making headways in this investigation concerning COVID-19 procurement in Gauteng. So with immediate effect, they have been able to identify that there is a need to open criminal cases, which they have done based on the evidence of the work they have done so far. That's why I'm saying the SIU investigation started at the end of May. So they have already identified that there are certain criminal activities that are worthy of opening cases about, and they in this PPE procurement, and that's their part that they are handling. The second thing is that they've also identified 2 officials in the Gauteng Department of Health who have allegedly enabled and facilitated this procurement corruption. So in the briefing that they gave us yesterday, firm briefing. They have identified that there are two officials who have been central to enabling this large-scale grant corruption. One of those officials is still in the system, and another had resigned. And I want to report this morning that the head of Department of Health this morning has taken action to immediately suspend the official who is still in the system. The head of Department of Health is here, Dr. Lukele. So this morning, as we speak this morning, the head of, because the briefing was yesterday by the SIU, and then the official who has resigned, the provincial government, together with the SIU, are pursuing legal and criminal case against that official. So this is the first set of action, preliminary set of action. We don't want to lose more money. We don't want more corruption to continue even after we have put in place an investigation. So whenever the SIU will come back to us and say there is another official in the course of the investigation that they have identified, there's the SIU is also following up on companies. So among some of these criminal cases, it's companies where they are convinced that there's a criminal case that that needs to be pursued against those. So this is the first set of action that is taking place on the basis of the briefing I gave last week. I also want to say that in the provincial government, we also have a disciplinary process that is underway regarding that e-gov, the irregular procurement in the Department of E-Government. The contract has already been cancelled, and the disciplinary process is underway against those officials who are responsible, identified by the investigation that those officials must be charged and must face a disciplinary process. So every week, we are going to be giving you an update every week. As the SIU investigation continues, we will be giving you an update every week. When we get an update ourselves, that the next thing that has been identified is the following, take this course of action, we will be doing that because it is about safeguarding the resources that are so crucial for this battle against COVID-19. And the SIU investigation is wide-ranging. It's not just about PPE. It is also about all other procurement that has to do with COVID-19. Every time something gets directed our way, the SIU investigations are also following up on those. And again, when they have been able to do work that will be able to bring to our attention that on this particular issue, we have identified what has gone wrong and who must be held accountable, take action, we will do that. So there are two sets of actions. The one is internal disciplinary processes. The other is in pursuing criminal charges against those responsible. And we are confident that we will be able to do this work. Let me just conclude on a matter pertaining to clean governance. Last week I said to you, the Gauteng provincial government for 6 years before this period had endeavored to put in place an open tender system that reduced the level of corruption and wasteful expenditure and irregular expenditure. That open tender system worked tremendously for us. The hyenas were at the door, the thieves were at the door. Once COVID-19 happened, the open tender system was not in play, was not being implemented. The hyenas attacked, and they brought great disrepute to our government. As part of the commitment to clean governance in Gauteng, I have also committed in my State of the Province address last year that we will do lifestyle audits for all members of the Executive Council. In other words, the Gauteng Provincial Cabinet, otherwise known as the Executive Council, myself and the 10 MECs. It took a while to implement this resolution because we were engaging different state institutions to say which one can be able to do that. I am glad to say to you, from next week, the State Security Agency will be doing lifestyle audits on me and the 10 MECs in the Gauteng Provincial Government. This is a resolution we took and announced at the beginning of this term. I finalized now with the State Security Agency that they are the appropriate state institution with the capacity to do this. So from next week, we are hoping in 6 to 8 weeks, they will be able to complete this work in 6 to 8 weeks of lifestyle audits on the members of the Provincial Executive Council in Gauteng. That is the Premier and all the 10 MECs in the Gauteng Provincial Government. And as I say, part of fighting corruption is to ensure that there's definitely no conflict of corruption and there's no one who is actually living beyond their means. This now has been finalized. This work is starting next week. So at this point, I just want to, MEC Lissufi, I want you to be brief today on the update on education so that we can come back to one or two additional health issues, the hospitalization, and then the MEC for social development will just be brief on issues pertaining to food security so that we can take questions. MEC Lissufi. The acting MEC for health has just been doing observations. The whole week he's been going to every institution, every place, every institution, every establishment, every facility in the province to go and make observations around what's happening there. And he says he will be able in the coming week to make proposals on how to strengthen the fight based on the feedback he has from institutions, from public health, the public health managers on the ground, from the trade unions, on how to strengthen the fight against COVID. So he will not say anything today. He'll be able to say something next week after he spent a week engaging with managers and unions and verifying what's happening in the institutions. MEC Lissufi, I'm giving you 10 minutes. Update on schools.
Thank you so much, Honorable Premier, members of the executive that are here, members of the media. Thank you so much for the opportunity. We'll take you through an update of the education sector. Apologies. If it can be flighted as quickly as possible so that we don't waste time. From the onset, we indicated that from the education sector, the most important aspect is safety first. That what we are going to do, we are going to ensure that in whatever decision we take, we must ensure that all our learners are safe. On that basis, schools took a break, and on Monday, we took the first team that came back, and we'll give you details of the number of learners that came back. We are preparing to bring back the grade 7s next week. will also give you the preparations towards that activity. And we've received lots and lots of applications from educators who indicate that they've got limitations of coming back to teach, and therefore they're requesting permission to work from home. We'll share those details with you so that we have an idea. Of all the schools that have grade 12s, can it be flighted, if I'm not mistaken? Tabo? It's not here? Sorry about that. Yeah. I'm really sorry about that. We're just trying to get the presentation so that everyone can follow. But I'll continue. I think people get it when when it's connected. Of all our schools that have grade 12 as a grade, 85% of our schools received learners back. It's only 15% of our schools that couldn't open, purely because they have to close to decontaminate, or they have acts of vandalism in their school premises or break-ins, and this caused the schools not to open. That is all our public institutions. In terms of our special schools, that is Elson schools, we only had 2 schools that could not open, purely on the basis that they identified cases of COVID and therefore could not open. So we are pleased where we are, that the schools that have grade 12 managed to reopen, and only schools that don't have grade 12, that we are still preparing them to come back on Monday. And I think this will give us an idea of where we are. Of the schools that could not open, there are 18, purely on the basis of, as I said, COVID cases, and only 5 schools that could not open on the basis of infrastructure vandalism or break-ins, and 8 other schools could not open because there were disruptions by either student body formations or parents' formation that still insist that schools must not open until we have gone through the wave. Thank you so much for the loading of the presentation. I can control it from here now. Thank you. So I want to give the exact figures of the schools that opened so that people can have an idea. We had 598 schools that have grade 12 that opened, and only 24 schools that have grade 12 that couldn't open. In total, we have 622 schools in our province. So this is very important because it gives an indication whether our school environment is safe, whether schools are operational in our province, and we can quite declare that our schools are operational. I've taken you through why the schools could not open. 5 of them is due to infrastructure-related problems, and 18 was because of COVID-related cases, and 8 was mainly because of disruptions, either by learner formation or parents formation or other formations that believes that schools should remain closed. In terms of attendance, we're giving you a 3-day collection of attendance in terms of learners. We are quite pleased that the numbers are increasing. We started at 56% on Monday, which was worrisome. It increased to 72% on Tuesday. By Wednesday, we're at 76%. We are still worried about those that are not reporting for school, and we are putting measures to ensure that either they register to learn online or they participate on our lockdown education so that they can be in a position to catch up. In terms of educator attendance, on Monday we started with 65%. It increased to 73% on Tuesday, and by Wednesday we're at 78%. This is the number of educators that are available. And we want to thank those educators because it's very, very important. The education system works around educators. Without educators, we don't have the education system. So the 78% that have reported for duty, we also want to thank them for that. So you can see averagely, in terms of schools that had lower attendance, with 125 schools that had lower attendance, it reduced to 117 on Tuesday, and it went down to 78. And we are working very hard also with those schools to ensure that everyone can come back to school. This slide indicates the number of positive cases that have been reported to in our schools as at the 5th of August. We're also keeping these statistics because they're very, very important, just to determine whether we are pushing back the virus within the schooling environment or not. Of all the schools, of the 2,088 schools that we have in the province, 18 of our schools have to close purely because they reported cases of COVID and they have to shut down. These are the schools that, as I'm speaking to you now, they are closed on the basis that they are waiting to get people that will decontaminate the school, clean the school, and immediately after cleaning our schools, will be in a position to reopen. So 18 of our schools, as I'm speaking to you now, are closed. The numbers might be low purely because we only have grade 12 schools. They will start to rise when we bring grade 12. So in total, if you add these 18 schools, in total thus far, we've got 2,099 schools that had cases of COVID, generally, including our institutions. Of that, 714 learners tested positive, and 1,671 educators tested positive. In terms of the support staff, 165 of our support staff tested positive, and 68 of our general assistant staff tested positive, whereas 20 of our youth brigade members tested positive. So within the entire schooling environment, 2,635 COVID-related cases were reported in our schools. The next slide gives us an idea of the capacity of our educators, how many educators we have, how many educators are ready to leave the workforce because they can't cope, and how many educators will we need to replace. So thus far, we've received applications from 3,699 educators that are above the age of 60 that have indicated that they want to leave the profession. Of the 3,699 educators, 2,117 are teaching at primary schools, whereas 1,193 are teaching at secondary school, and 389 are teaching at special schools. Of these applications, we've managed to ensure that we approve 2,631, and we've declined 200, which simply means we need 6,747 young new teachers to come and replace the educators that are leaving the profession. The 6,747 will replace those that are above the age of 60, that is 3,699, and those that have comorbidities that believe that they can't work from our school premises. So that's the effect of what we need. That is why we'll always appreciate those educators that are reporting for duty daily. This is a very important slide that we monitor because you will see from this that our human capital budget will start to hot up on the basis that we need to recruit as many educators as possible. We are pleased that the National Department of Education has started the process of creating a database to recruit young people, and will tap on that database so that we can get as many young people as possible to come to our schools. In terms of infrastructure, unfortunately, we still have 353 schools that have been affected by vandalism. As you are quite aware, every time we close schools, we know we'll have cases of break-ins. So during this period where we closed schools, 8 of our schools were broken into, and this affected the reopening of some of those particular schools. Thus far, 351 schools, we have appointed service providers to go and repair those particular schools, and we are pleased that they've made huge progress. In terms of school nutrition, we are doing very well. Between the period that we closed, we had 166,000 learners that received school nutrition. Unfortunately, there were challenges on the basis that you don't know how many learners are coming because we're implementing a court case that compels us to provide school nutrition even during school holidays. But we are doing very well in terms of the numbers of those that have started to arrive to receive the school nutrition. In terms of scholar transport as well, we are working together with the Department of Transport in terms of identifying learners that need to use scholar transport in a safe environment. And thus far, the department is transporting almost 42,000 learners daily. And we are working closely with the Department of Transport to ensure that all COVID-related matters are followed and adhered to. In terms of safety in our schools, unfortunately, we still have people that are disrupting schools, in particular in Tshwane and part of Johannesburg, and we have requested law enforcement agencies to assist us. That disrupting the grade 12s, and this in some areas is affecting attendance of the grade 12s. But law enforcement agencies are providing all the relevant support that we need, and we are pleased with the kind of support that they are giving us. These are the new dates now, as Gauteng, that we are bringing other grades. I've indicated the grade 12s are back. On Monday, it's a public holiday, so a school holiday, so we don't expect any new grade. The new grade will start to come in on the 12th, and from there, we are taking 2 new grades per week so that we can conclude all other grades. We are pleased that in Gauteng, 6 of our grades are back. Before the president announced the break, we are left with almost 4 of excluding schools with special needs. We really believe that by end of August, all our grades will be back, and this will allow us to prepare for the end of year academic support. There are main academic support programs that we are giving to all our learners, even those that are still at home. We're giving them guidance on some of home education. We're also giving them material that they can collect and bring after a 14-day cycle. The material that they need to collect is their homework, a test that they need to write, and some of the assignment that they need to do. And every 14-day cycle, they bring the work and they get new work. And that's how we've been pushing it in our province. So we really believe that the support that they've been giving was helpful. We also have institutions and other companies that are assisting us with additional work, and broadcasting institutions that are assisting us with additional work. And we are quite pleased with the work that they are giving us, and some of the digital platforms that we've presented as a department. So from the 24th of August and beyond, we'll ensure that the new crew that is coming back will get their PPEs, will get their school cleaned, and they will get their lessons plans, and they will be ready to push the academic year. You are quite aware that the academic year is now being extended until the 15th of December, and we really believe that that at least month extension will assist learners to catch up on those things. Where there are disruptions, we are dealing with those disruptions, and we are requesting the law enforcement agencies to always put an eye on our education institutions so that we don't have any major disruptions. We want to leave it here, Premier. Thank you so much.
Okay, I think we will now ask Dr. Mudisani to speak briefly about hospital. Oh, okay, we'll start with MEC Mukheti, and then Dr. Mudisani will speak about hospitalization.
Thank you very much, Premier. Good morning, colleagues and members of the media. I don't know if I'm audible with my mask on. The last time I was here, I experienced a very bad experience. Thank you very much, Premier. I'm going to be very brief. It's only 2 slides that I'm going to present. It's on food security and social relief. We've got 5 food banks in the whole province, in the 5 regions. Maybe I should wait for the slide. Can I give...
You can control it.
Yeah, you can control it for me. I'm using my phone. Thank you very much. As I've already said, we've got 5 food banks in the whole province, 1 in Johannesburg, Tshwane, Ekurhuleni, Sidibeng, and West Rand. And combined, these food banks to date have distributed 404,602 food parcels. A number of individuals or families supported is over 2 million. And with regard to the calls received, our response is 109%. However, the demand for food surpasses our capacity to meet our daily needs. We therefore call upon support from business foundations and civil society to also support us on that. However, those initiatives must be centralized. They must be given or donated to the food banks so that they can be properly accounted for. And in terms and when it comes to homeless shelters, we've got 5 in all the regions, and then currently we're sitting at 2,587. As we all know that this is a very mobile, highly mobile community. You can't confine them in one space. So our numbers fluctuate daily. And then, but we do have some successes. We provide them with 3 meals per day. We give them psychosocial support. We also do medical assessment in these shelters and give treatment for those who are on substance abuse. And then from the 527 homeless beneficiaries have absconded. As I said, they are highly mobile. You can't confine them in one space, and more so that the regulations have been relaxed. We can't keep them against their will in our shelters. And then 520 have discharged themselves. Some have gone back to work because they only needed a temporary shelter. And then 346 were reunited with their families. This is what I meant when I said we do have some successes. Premier, I think that is about that with social development. Thank you very much.
Good morning, Premier, MECs, heads of departments, and members of the media. I'm going to present very briefly the hospitalized patients, looking at the trends in the last few weeks. At what we saw as our first peak in July, middle of July, We were admitting new patients on a daily basis around between 300 and 350. And since the... I must get closer. Okay. Thanks. As I was saying, we are analyzing the trends from the last 3-4 weeks in terms of admissions. As I was saying, at the peak, well, probably it's not the peak, but at the highest admission rate in the winter, around the 15th, 16th of July, we were admitting between 300 and 350 patients a day. And that number has since come down gradually over the last few weeks to yesterday's admission, actually as of the 2nd, at about 110 patients. So in terms of the actual admissions, the numbers have been coming down, and that has translated also into the number of patients that are actually in the wards. At the same time, in July middle, there were on average between 5,700 to 5,900. At some point, we reached a peak of over 6,000 patients, total patients admitted. And at that time, the utilization of oxygen, which is an important commodity for management of COVID, we had on average 1,500 patients on oxygen in the wards. Even I think there is a concern also about the availability of oxygen, but I would confirm that at this point in time, there is no problem. The contracted supplier of oxygen has given us comfort that there won't be any problems. But sticking with the number of patients, as of the report of yesterday, the number has stabilized, and the Premier did allude to the numbers to 4,600, 4,700. It's a drop of 18% in the last 2 weeks. It may not be significant, but in the context of the bigger pandemic, 18-20% is a good drop in terms of the pressure on the services. And yesterday there were only 978 people on oxygen. So indeed the numbers are stabilizing. It may still upswing as it has been mentioned that we should not be complacent. We're still planning for the bigger surge. And in terms of the management of the hospital beds currently in the province, there is collaboration between the public and the private sectors. We share data on a daily basis. We have public sector patient dashboard, which the managers can see on at any given point the number of patients admitted across all levels of care, general wards, those that are on room air, those that are on oxygen, up to the ones on ventilators. And it's for both sectors. That also helps the province to have a clear understanding of the pressures at any given point. The dashboards can be drilled down to a hospital, meaning even as I'm sitting here, I can see what is happening at each and every hospital under our care. The public dashboard is that detailed. Unfortunately, we're still getting the general data for the private sector, but I'm sure it will also be drilled down to be able to see per hospital, per sub-district, per district, the number of beds that are available, so as to also manage the patient flow in the province. Premier, that would be the end of my presentation.
Dr. Mdisani is the DDG of Health Services. So he is the one who monitors hospital admissions. So when he talks about the dashboard that is available to see which hospital is full, how many beds are available in the private sector and in the public sector. So if we have a problem in another area and we need people to be admitted, where can they be admitted, in the public or private sector? So he is responsible for managing that. Thabo, we can take questions.
Okay. Let's take questions now. Where's the mic? Can we have the mic that side? Yeah.
Good morning. Hello. Good morning, Premier. First question, I'm Mangoba Mkhun from ENCA. The first question is perhaps on that SIU investigation. Are you perhaps able to shed more light about the role that these two officials played in this whole corruption scandal? And secondly, do they actually include, I don't know if you can talk about this, is the former CFO Kabelo Lifenya also part of those that are being investigated? And then on the issue of Sanco had given you a deadline to give them a report by Thursday, which is yesterday, and failure to do that, they threatened that they might take you to court. Have you given that report to Sanco? And what do you say to their calls for you to step down?
Which report is that?
A report, the SIU report. They demanded that the Premier must give them an SIU report. This one.
All right, good morning. Good morning. My name is Mariketla Matlave from the SABC. Premier, we were at Telemokwerani Hospital yesterday. I'm sure Acting MEC Mamabolo might be aware that there is a lot of disgruntled nurses there who say that it looks like during the provision of these PPEs, more especially the jumpsuits, they are just given randomly without the sizes. Obviously, when they're in those jumpsuits, that's how they tempt them. They then tend to just tear off or tear apart when they actually attend to the patients. So the concern here also is about the quality of those PPEs. I just want to understand if you are aware of those complaints coming from these nurses. And the other question is with regards to Tembisa Hospital. I mean, we've had complaints by some of the members of the community there saying that once they send their loved ones to the hospital, they struggle to get hold of the officials there just to understand about the update on the status of their loved ones, and also the main issue being that after a few days, then they get a call to say that your loved one had passed on to COVID-19. Are you aware of these issues? We did raise them a couple of weeks ago, and we understand that Health Ombudsman was sent there to do some investigations. Do we know how far those investigations are? Do we know if there is a report that's going to be released with that regard? Just last question to the MEC for Education, Panyanzali Sufi. I heard you mentioned the number of infections among learners, teachers, as well as non-teaching staff. Do we know about the numbers of deaths among those people? Thanks.
Okay. Are those all the questions? I've got a few here that I'll read. There's one from News 24, Sesetu. The Democratic Alliance in Gauteng is calling on MEC for Social Development to provide clarity on the price of food parcels. And the question is why the price of food parcels differ from one municipality to the other. Yeah, this question, it's a statement by the DA, I don't know why. Let me just ask the question, read the question. What are the circumstances surrounding the pricing of food parcels? Is the province not worried about these differences? And is there anything going to be done about that? Then there's a question from Gaupalelwi Palatse from Jacaranda News. The Gauteng Health Department allegedly wrote an authorization letter allowing Macro Woodmeat to sell cigarettes for a rehab center in May. Is the Gauteng Command Council aware of this? And what will be done since this was during the ban on the sale of tobacco? Then there's a question from Likwa FM. Can the Premier share the hotspots in Mfuleni local municipality? Then there's a question from the SABC. I think this one is also about the quality of PPE. Prof. Lukele will be able to explain what quality we have. They say there are N95 and KN95, and some of the PPEs, some of the masks in the hospitals do not have barcodes, apparently. So we will get that from Prof. Lukele. Yeah, those were the questions. I think the MECs will answer, and then the Premier will answer last, and he will also then do concluding remarks. Okay, MEC Lisufi will start.
We must check MEC.
Yeah, and then MEC Mamavulo can, if he wants to answer any of them. Okay. All right.
Thank you so much, Thabo. The question that was directed at the Department of Education was relating to the number of people that died. It can be learners, can be educators. That information is kept by the Department of Health on our behalf. So I think Prof from the Department of Health can make that information available. We don't keep it because they pass normally from hospitals and outside the schooling environment. So we don't have that. But indeed, we had principals that have passed on. I'm aware of some of the principals and some of the educators that have passed on. But that information is collated by the Department of Health. I think if they don't have it now, I think I'll speak to Steve from our communication team just to get it, and then we can pass it over. But I don't have it currently, but the Department of Health will assist us with that information. Thanks.
Thank you, Honorable Premier and MECs. I'm going to address the questions which relates to administration. The first one is that one which relates to the letter giving permission for tobacco. This was informed by the request for a rehabilitation center which keeps patients who are having symptoms of withdrawal, and they were very restless and wanting to escape, and it was then supported by a specialist, psychiatric specialist in that field. And it was actually at the time when at the interface where the final pronouncement of tobacco was made. So that permission was given in that context for 1 day, and they didn't buy it, and we then had to allow them, but after that it was never implemented. Thank you very much. It was on a medical informed basis that it was made. The next question is on the PPEs, on the availability and quality. Earlier in the COVID, there was a lot of questions about quality, and we then implemented a system where a quality assurance trained person, specialist, informed by the people on the ground, the clinicians, and also informed by the guidelines from the National Department of Health that there are certain companies or certain products which are certified to as we should distribute, for instance, like the N95s. Certainly the KN95 was found to be problematic, and we took that off. So there are systems in place in ensuring the quality. Similarly, with the quality of durability and adherence, that is in place. The one thing I would like to assure, and it has been indicated several times, that at the warehouses, those PPEs are available. The challenges relates to them being distributed to the facilities, but we have since established champions of PPEs at each facility to ensure that the appropriate quality and the appropriate PPE at whatever you are working at is made available. Then on the question of the matter of Tembisa Hospital, where we unfortunately lost a COVID positive patient, that matter was investigated by our quality assurance team. The family was visited by the department, and that report can be made available to the team. Thank you, Premier.
Thank you very much, Honorable Premier, and thank you very much, News 24, for the question. The first question was why there are different prices in different municipalities on food parcels. The reason was that the assessment or the evaluation of tenders were done in different regions to avoid giving a tender to one company that will end up not meeting targets because of the magnitude of work that would be given. And then we actually had a saving of 25 million. And then question 2, is the department not worried about anything about inflation of prices? Yes, we are in the process of auditing that. Gauteng Audit Service have started auditing on all COVID-related procurement. Thank you very much. Premier.
Okay, so one of the questions from you, Mangoba, is what is it that the SIU identified? I'm sure you do not expect me to say things that must be answered in the disciplinary processes and in court. But it is enough to say that the SIU has identified 2 officials. I can indicate that is one of those officials is the former CFO. I can also indicate that another is a chief director responsible for supply chain management. That's the area of procurement. You asked a question about the call made by Sanco. I have received two response documents from people organizations that are all claiming to be Sanco that are different. I don't deal with politics. I deal with governance. So I want to leave those things about the 2 different organizations claiming to be Sanco. I will leave that to the ANC. The ANC is the one that deals with issues like that. People who are claiming to be representing organizations. All I can say is that I think what we are doing is acting on once there is a forensic investigation that is done and it identifies the wrongdoers, we put that to a process of taking action. And I think the commitment that we are showing here is that it's also important to act early. If acting early will help stop, sometimes you don't have to wait until the entire investigation is completed. You've got to take immediate action, disciplinary processes of government, but I particularly want to emphasize the laying criminal charges. I think once the processes that we have undertaken with the SIU now will really make sure that we have had situations where people go through disciplinary processes in government and they just emerge essentially scot-free through that. If there was a different course of action, including particularly criminal charges, it would have been otherwise. That's what my focus is. Disciplinary processes and where the criminal charges must be laid. That's what I would like the provincial government to do. It must be a culture that when an investigation identifies money must be recovered, that the process of getting to recover that money takes place with immediate effect. Where money has been lost, that money must be recovered. Lost to a service provider appointed irregularly, that money must be recovered. A process that was done wrongly, those responsible, the official, and the companies, because I think it's important that we move. We want to make sure that any official or any company that is found to have been involved in this act of corruption, face the full consequences. And amongst those is to recover the money. And the other is that this is time in our country to send people to jail. I think we have talked for too long. This is time to send people to jail. And these cases must be tied to ensure that there's successful prosecution, so that there's no protracted processes that don't result in successful prosecution. I want to conclude. My message to the people of our province is that we've got a pandemic right here to fight. We've got to reduce the number of infections. Again, let's drive down the number of infections. Even this month of August, which is the month that the modeling said it is the month that coincides with the peak, we are going to do everything, and we want to do everything. My message to our health workers everywhere is that continue to do the good work you have been doing. We want to support our health workers. We want to support them to save lives, more people recovering. We want to see the recovery rate increase. The country's recovery rate is quite good now. The recovery rate in Gauteng must increase. It can only increase if all of us are focusing on the job. And the job is to save lives. At the same time, let's see concrete results coming out of acts of corruption that have taken place on PPE. These despicable acts of treachery, basically, that have taken place at a time we are facing an existential threat of a pandemic that has hit the world so hard. So we are going to continue to provide all our energies to the campaign on COVID-19. We are going to do that. Simultaneously, we are going to make sure that these investigations that are taking place, everything that comes out of it, action is taken. I want to be able to say by the time the reports, all these reports on investigations are out, we should have succeeded in recovering money. We should have succeeded in putting those responsible who deserve to be put behind bars must be put behind bars. Recovery of money and facing consequences for wrongdoing. That we are going to do simultaneously. We are not going to focus our eye off the ball. Simultaneously with addressing corruption, we are going to be making sure that we are going to these hotspots in different places. The question that came about the hotspots in Sidibeng from the radio station, I think the best thing will be to send that information to the radio station. Our communication team will send the information to the radio station about where the hotspots are in Sidibeng, because this is public information that we must share. Radio station is a very important medium. They will be able to tell the people in the Val, in the different areas, about the need to act. I want to emphasize that the decision that we have made to finally ask the State Security Agency to do the lifestyle audits is a matter that we have been seized with for a while, about which will be an appropriate institution. And I know that they will also collaborate with the South African Revenue Service. In this province, they work together in this province to be able to also look at information that SARS is able to provide, and then the information that the State Security Agency will be able to provide. So in our province, when they do vetting of our senior officials all the time. They all collaborate. The State Security Agency collaborate with the South African Revenue Service. Also, when they vet companies, they do the same. They collaborate. So I want to emphasize that they will be able to collaborate at state institutions just to make sure that we get a satisfactory response that of the political heads who are in charge of departments in our province and government and the executive have no potential conflict of interest or they themselves are not involved in things that compromise the business of government. And the business of government is to basically serve the people of our province. Not serve a particular group of people, not serve our families, but serve the people of our province, not serve our friends, but serve the people of our province. So thank you so much. I think we are done. The fight continues. I would like to invite some of you, the media people, to the work that's being done by the health workers on the ground in the hotspots. They told me that they are now focusing on Soweto as the number one hotspot in the hierarchy of all those hotspots. They told me that they are directing this community mobilization at street level. So the focus is now going to Soweto. And I would like a situation where some of you in the media join our healthcare workers. And they work with the community organizations to get the message out in areas where the infection rate is stubbornly high. It may not be growing, but if it's persistently high, we've got to bring it down. So we don't only want it to be flat, but we want to bring down the infections in all the hotspots. We want to do what our modeling team says the hotspots are burning themselves out. We want to see a hotspot as actually from being a hotspot to having very, very few active cases running their course. But I also want to say that there is no time for complacency. We don't want a situation where there is the second wave that catches us thinking that we are over it. My message to the people of our province is that we are still preparing we are not out of the eye of the storm yet. And it is better to work on that frame of mind that we are not out of the eye of the storm yet. It is better to be so ready, even if the storm does not come, even if the peak does not come. It is better to be so ready for the peak, to the level of consciousness, the level of cooperation with communities, the level of interaction and compliance with the measures that have been, should be so high that even if the peak comes, its impact will be much less. So the people of Gauteng, the storm is not over yet. We see positive signs that we are weathering the storm, but let's continue to get ourselves in the frame of mind that we will still face a more difficult situation. So that if it happens, we are ready. If it doesn't happen, we will still be much, much better. This is not time to relax. This is not time for complacency. Thank you very much.